Okay, hello everyone and welcome. I am Amanda Applegate. I am with KPhA and now newly with CPESN Kansas. I want to be maybe the first to wish everybody a happy World Pharmacists Day. So if you didn't know, that is September 25th of each year. So take a moment to celebrate yourselves and your team today. We just had so much going on lately that I wanted to take a few minutes of your time today to lay out the opportunities that Kansas pharmacists currently have for clinical services, as well as touch on just a few that may have some possibilities in the future as well too. So, we know you're aware of what you're allowed to do by statute and scope, but we also, really want to make sure that pharmacies are not doing services that are not sustainable. If you're not getting paid, you really shouldn't be doing it. And so with that in mind, I'm going to go ahead and zoom through what are the current options for all pharmacies, including reimbursement information where that is publicly available. So obviously not delving into private contracts or anything like that, but if it's CMS published, we have included some of that information. Then I'm also going to touch on opportunities for Kansas pharmacies that are specifically in CPESN Kansas contracts as well, because those opportunities are really starting to stack up. So because we are fast and we're going pretty fast here today, we're going to be recording this for those that aren't able to be with us live. I'll ask that everybody hang out on mute until we get to the Q&A. Totally feel free to drop any questions in the chat in between then, but for right now, I'm going to have KPHA's September APPE student, Laura Wickstrom, helping me out, keeping everybody on mute, monitoring the chat so we can ask questions, as we get to that. But we'll zoom straight through here. So as soon as we are ready to go, again, drop those questions into the chat. We will answer them as they come up. So because I'm mentioning medical billing here today, I do want to just quickly touch on what that enrollment process looks like, but it's well beyond the scope of today's program to go into detail on this. So if you want more information on it on this process, so from credentialing all the way through contracting, training, billing, et cetera, please hop over to KPHA's clinical services resource page. There are a lot of different pages of information on that whole process, as well as some tutorials that were helped out with us by our KPHA partner, Curis. So we appreciate that assistance. But if you have any questions about that medical billing process, that would be a great resource to go over to. So we'll start easy with immunizations. Everybody is hopefully pretty used to this process already, is that most immunizations right now still go through the pharmacy billing process. That covers most commercial plans, Medicare Advantage plans, as well as Medicare Part D. However, we are starting to see an increasing number of pharmacies attempting to bill actual commercial insurances on the medical billing side, because there usually is an increased payment available for that and you avoid PBM fees. So just kind of as a heads up, happy to connect people to resources about that if you're interested. But on the medical billing side, so the side that we are forced to do the medical billing side on, one of them is going to be our Medicaid process. So all of our Medicaid or CanCare members, adults do need to get vaccines through somebody that is accredited, credentialed, et cetera, for the medical billing process. So again, I'll point you back to that KPHA's clinical resource page for more information about that. I will mention, because we get questions about this quite a bit, that pediatric vaccines on Medicaid do need to go to a Vaccines for Children site to be able to be paid for that pediatric vaccine administration. So pharmacies are eligible to become VFC sites. And if you are interested in that, there is a spot in the survey we'll post at the end for learning a little bit more about that process and the documentation that's involved in that. And then also just alphabetically here, Medicare Part B, I'm sure most are very used to that process overall and probably have a plan in place or a provider to assist you with that process. So next available for all pharmacists in the state is medication administration. So we've had med admin allowed in our state since 2019. And medical billing is a possibility for it. We are still working with Medicaid to get a policy written for that part. But other contracts that you have or other places that you were already signed up to be a provider should be able to pay you for this service. Another thing we have listed is a handful of pharmacies do have direct contracts with manufacturers to get paid for that vaccine administration. So certainly something we're not seeing a lot of in the state, but we are starting to see a little bit more of this creep into general practice. Some other things available on our scope, I do want to mention opioid antagonist dispensing, or naloxone dispensing as it's commonly known. There is an additional drug, which is why we've just really changed our verbiage to that opioid antagonist dispensing. This is available via statewide protocol. And for right now, for the most part, it is available pharmacy billing, is that you are actually billing for the drug itself and only the drug itself. Although we are working with plans as well as Medicaid to hopefully have a process in place to be able to bill for additional counseling time, because that is mandated by state law, but is currently an unfunded mandate on the Medicaid side of things. So we are working closely with that. Probably earliest we'd see that would be late next year, but hopefully stay tuned, because this is certainly something we want to encourage all pharmacies to participate in. Test to treat. So I know that this is a service that many of you are currently working on getting up and off the ground in your pharmacies right now. This is also a statewide protocol and covers specifically flu, strep A, pharyngitis, and uncomplicated UTIs. Your pharmacists can pick one of any of the protocols that's available. So there's pediatric and adult flu, pediatric and adult strep, and uncomplicated UTI. You do not have to do all of those services. If you just want to do influenza testing, that's totally fine. You can just pick that protocol to sign and maintain on file. There is medical billing available for this on the CanCare side of things, or Medicaid, as well as we've been assured Blue Cross Blue Shield of Kansas. But we're also seeing pharmacy billing available for this as well, too. Many of the current contracts are just offering contract addendums, so it's not something that you can just bill tomorrow if you've not interacted with these companies before. But we are aware of at least Cigna and Express Script that are offering contract addendums to be able to bill on the pharmacy benefit side for the time and effort, as well as the product, to do the test and treat process. I will also mention, for completeness' sake, that the PrEP Act is still covering pharmacists to do test and treat nationwide for COVID specifically. It does require a serum creatinine. And so I think, getting evidence of that has been what's held many pharmacists back from that process, but is certainly something that we are seeing. Some of the pharmacy billing contracts do cover COVID testing specifically, but do note, if you're putting significant work into getting that off the ground, that is not COVID is not included in our statewide protocol, unfortunately. And so COVID test and treat will end at the end of this calendar year, unfortunately. So some other things that pharmacies are eligible for is going to be diabetes services. And this is commonly, targeted towards the Medicare Part B space, because that's where we see the most available billing for these services. So I'll start with diabetes self-management education. These are for people that are diagnosed with diabetes and are referred by a clinician. So generally going to be a physician, but depending on your area, may be different. So Medicare Part B patients are eligible for 2 to 10 hours of this per patient per year, 10 hours in the first year, 2 hours ongoing. And the latest data that we've seen is that only 4% of Medicare individuals that are eligible for this service have received this service, so that initial 10 hours of education. So it is a very underutilized service. A lot of people are eligible for this. It is required to be accredited, but if you are interested in that, that is something that KPhA has the resources to assist your pharmacy with, and we are certainly happy to help you get these services off the ground, as well as connect you with the resources necessary for the medical billing for this. And so again, where there are publicly available costs through CMS, we have listed those on the slide so far. The other option on this is going to be diabetes prevention program. And the difference with this, and where a lot of pharmacies are interested in this, is going to be that this is not a pharmacist program. It can be, it's not financially viable, I will say, for the pharmacist to teach these classes. And it's often more effective for a trained health coach that is a technician or other member of your community to actually do these group classes to prevent diabetes. So for people that are at risk of diabetes, the technician would, or a member of the public working with your pharmacy would walk participants through a number of lifestyle modification classes aimed at preventing progression to diabetes. So there's two options on how to do this. Your pharmacy can get independently accredited and do the medical billing for this process. However, we also have a new option available to us in the state that is affiliating with an umbrella hub that is already accredited, and then your pharmacy to bill with that umbrella hub. So you don't need to get that accreditation. You don't need to do the trial classes, et cetera. So this is certainly something that we are working to develop the process for. So especially if you have technicians that are really interested in lifestyle modifications, or maybe they've been through a course like this in the past and would like to help others, that affiliation would be a really great way to go about that. So currently affiliation will help you bill Medicare Part B specifically. But the nice thing about that is that if you go to that affiliation route, again, not only do you not have to go through that accreditation process, but you'll also be eligible to bill Medicare Advantage plans starting in 2025. So we're really excited about that process because that's something that is new and we haven't seen before. So we're really hoping that pharmacies that are interested in it are going to take advantage of that, like I said, new affiliation side of things. So with that, those are all services that are available to all Kansas pharmacies. So I'm actually going to flip a switch here and we're going to flip colors on our slides. Hopefully that's obvious to some degree. Is that we're going to flip to, again, CPESN Kansas programs specifically. And so again, this is going to be only pharmacies that are enrolled in that CPESN Kansas network. And so a couple of things about this is I'm sure most pharmacies in the state are going to go ahead and meet those core service requirements already. But one additional thing that as we have moved CPESN Kansas in with KPhA, we are now requiring that CPESN Kansas pharmacies do have pharmacy membership with KPhA. And the nice thing about that is then all pharmacists and technicians at that CPESN location receive communications about important things like this. So just a quick reminder about the requirements in order to enroll in that CPESN Kansas network. So then under that network, once you are enrolled, you are eligible for a number of the contracts that CPESN negotiates on your behalf, and then you can opt in to one or all of any of these contracts that CPESN is offering. So the first one is going to be vaccine clinics. This is something that has been ongoing for a little while, but has recently expanded from just long-term care facilities that are referred to pharmacies to pharmacies being able to self-refer into the assisted living and senior center programs that they're maybe already working with. So an email about that was sent out this morning, actually, to all of our CPESN pharmacies. So the great thing about this is that, you are used to going out to facilities and being paid for your product, but this contract actually pays for staff time spent at the clinic, in addition to your pharmacy still being able to bill for the product themselves too. So this has been a really valuable expansion, and we are very excited about this. It is a limited time. So we encourage that, especially during this respiratory vaccination season, that if your pharmacy is working with assisted living facilities, that you do go ahead and opt into this program so you can get an additional payment for your time in addition to your usual billing for the vaccines. Next, available to some select CPESN locations right now, but we do have an upcoming contract that will be available statewide, is going to be the process of pharmacies working to do clinical trial screenings. So a couple of different steps in that process, and depending on whether or not the patient is eligible and how long you spend with them, the pharmacy is able to bill for that time and those referrals. So that's something where we are continuing. Again, it starts out fairly limited, but we are looking at contracts that do expand that statewide. So it's not tied to a specific clinical trials location. So pharmacies that have participated in this so far have been very satisfied with this program, both on the interaction with patient side of things, but also on the financial side of things as well, too. So this is a project we're certainly encouraging that if your pharmacy is eligible for this, that you do participate in it for a number of reasons. Three things we have upcoming here. One of them is starting fairly soon. We do have a specific plan that is going to pay a technician-led program to survey patients on their health risks. So it's pretty simple as far as the pharmacy goes, is the plan is going to provide a target patient list, and then also the ability to complete those surveys to the pharmacy. And so hopefully we can get through a number of those surveys fairly quickly. And again, this is not a burden on the pharmacist, but is a technician-led program. So we're pretty excited about that starting here soon. Another one that I think will be especially attractive in the rural areas of our state is going to be telehealth hubs. So the pharmacy is working with a health plan that is going to provide a tablet to the pharmacy with telehealth connection app. The pharmacy will need to find private space in the pharmacy for patients to be able to connect with that telehealth provider. It is starting specifically with acute care, but is also going to include chronic care. The pharmacy is paid for connections at the site, but they're also going to be paid for assistance with things like physical assessment or point of care testing where needed. And we'll bill on a fee for service execution of that too. So that we're looking at probably late fall, early winter, especially as more respiratory infections start to roll in. Timing on that is still to be determined, but we're certainly interested in knowing how many pharmacies are going to be able to participate in that too. And then a final upcoming project, this is something that is very time sensitive, is that our CPESN network in partnership with KPhA is going to be looking at another round of Flip the Pharmacy funding, which offers your pharmacy personalized coaching to implement clinical services, especially with those that require medical billing. And the idea behind that is to get technicians and pharmacists to the top of their license, is making sure that you are running your pharmacy in an efficient manner, so that you can make these programs that you're rolling out sustainable for your pharmacy to maintain moving forward. So as a part of it, you're going to get access to a learning library of medical billing materials, and part of the project is helping you fund that access to both the library as well as the coaching services available. But we're also looking at the ability to provide incentive payments to the pharmacies for meeting performance goals, such as submitting your first medical billing claim, and then an escalating number of 10 claims, 20 claims, 30 claims. So if your pharmacy would be interested in that, we do need to make sure that we are getting surveys back from pharmacies and interest back from pharmacies ASAP. So we've asked that if you are interested in that, you do let us know by September 30th. And you'll let us know by filling out this survey. So we do have a jot form that Laura is going to drop in the chat here to learn more. So it has options to fill out, like I said, for any of the specific programs that are open to everybody, as well as if you're interested in learning more about CPESN, and then specific to the CPESN pharmacies. So only CPESN pharmacies will receive more details about the CPESN contracts, because obviously we can't share those contracts outside of the network. But this does have information. So again, if you are a CPESN pharmacy or you would like to be one, we certainly want to chat with you as well too. So we see all of this working together as a whole. And we are to the point, I think, what I like to see is as a tipping point in Kansas is we've spent the last decade or so really building to have additional codes that pharmacies are able to bill on the medical side. And we are just finally now to the point that we have enough codes that it's going to be a viable service for pharmacies moving forward.